Kia ora, I'm Chris Fawcett, one of the GPs at Horodpai. This presentation is about the COVID-19 vaccine. Just to answer a few questions that people have had about it. Um, so we'll start with a bit of an overview about the COVID facts, the epidemiology, which is the pattern of disease, how we've tried to prevent COVID spreading in New Zealand, the vaccines, particularly the ones that are approved in New Zealand, the dosing and administration and side effects. So starting with COVID itself, it's transmitted in droplets. There is a limited amount of transmission on surfaces, which is what fomites mean. The incubation period, so that's the time between getting infected and getting symptoms, is about 3 to 5 days. But the problem with COVID is that the infectious period starts before the symptoms do, and transmission, or the ability to transmit the virus, peaks 5 days after symptom onset. So it's a tricky virus. You can pass it on before you know you've even got it. The burden of disease is mostly with older adults. We'll talk about that in a minute. So who's at risk? Elderly, male, smokers, obese people, people with pre-existing medical conditions such as type 2 diabetes, cancer, lung conditions, cardiovascular disease, as heart disease, or kidney problems. If your immune system isn't working so well, and although pregnant women are not at increased for infection, they do have increased risk of severe disease. Healthcare workers are obviously increased risk, and Māori and Pacifica are 2 to 2.5 times likely to have bad outcomes. So this is an old slide from May 2021. You can see that most of the COVID we have in New Zealand comes through the border as imported, with only a small amount, fortunately for us, of locally acquired diseases. This is from the World Health Organization, showing you the cumulative total around the world, and you can see the pattern of COVID coming and going in waves, and the number of deaths on the right hand side. First waves in Europe, and then the Americas, and then Asia. So our strategy has been to eliminate COVID rather than try and live with it, as they've tried to do in some countries. So we've actively encouraged COVID swabbing for symptomatic people. We've tried to have a very good contact tracing system, and the apps have been developed in order to allow that to happen. So please use your app as much as you can. Mandatory use of face masks on public transport and domestic flights, and then the basic things like not going to work if you're sick, washing your hands, sanitizing, and then obviously we're into the next phase, which is the vaccination strategy. So there are a whole lot of different types of vaccines, and I won't go through them all, but some of them rely on viruses that have been killed, others rely on parts of the virus. The one that we're talking about is a new platform. It's an RNA virus, an RNA vaccine that injects a little bit of the virus RNA, a small part of it, into the body to produce parts of the spike protein so that the immune system can recognize it next time around. It means that the body, when it next runs across that spike protein, is already pre-prepared to deal with it and can mount an early and vigorous response. So although this has not been used in this way before, there is plenty of data suggesting this technology was developed over the last 20 years or so, and it's not new in that sense, although fortunately it was sitting on the shelf for us to be able to pick off when this pandemic began. So in New Zealand we're using the Pfizer-BioNTech vaccine, 2-dose vaccine, and those are some of the other ones that are in the wings: the Janssen, the Novavax, the AstraZeneca, which you've probably heard about being used in Europe and America. It's not a live vaccine, it's a small amount of the mRNA encoded in the viral spike, and so it's a wee piece of the blueprint which is surrounded by a fat bubble and given to you. It's got some salts and sugar in it, nothing significant, and that allows your body to be able to bring it into the cell and develop an immune response to it. It's 2 doses at 21 days apart. There is some discussion about whether 21 days is the right dose at the moment. It is, but in future it may be that the dosing will be spread out a wee bit further than that. After a vaccine is normal with most vaccines, there's an observation period of 20 minutes to ensure there's no allergic reactions. It's very effective. The clinical trials say 90 to 98% after 2 doses, and real-world data, so that's when they rolled it out, show the same sort of thing. It doesn't seem to stop you totally getting the virus on board, but significantly reduces your chance of going to hospital, and you may still be able to pass it on. There's a few unknowns in this thing, but basically it will stop you getting sick. It's unknown how long the immunity is. There's no concerns about breastfeeding. We try and space the COVID vaccine away from other vaccines, not because there's a problem with interaction, but just really because we want to know if there are side effects, which vaccine is causing a side effect. There is talk about booster shots in the future, and that may happen, but really at the moment that's a bit of an unknown. Side effects are the common sort of things that you'd get. So this is just a slide comparing MMR, influenza and COVID-19. Pain at injection sites is quite common. Fatigue, headache, muscle aches, generally feeling unwell. Serious side effects are quite rare. Anaphylaxis, that's a major allergic reaction, can occur with any vaccine. You can get a Bell's palsy, which is a facial paralysis that doesn't last for too long. And there's more recently been discussion about inflammation of the lining of the sac that the heart sacs in, which is pericarditis, which seems interestingly to affect young males more. It doesn't last long and it doesn't cause any permanent problems. So this is a site where there's a lot of work being done looking at the adverse effects of COVID-19 vaccines. So 3 main vaccines all seem to be effective against the variants. So this is an article from the British Medical Journal. It looks like the 3 main vaccines are quite effective. May not be quite as effective against some of the variants, but by and large they still work very well. Does raise the question of booster shots if the virus mutates. That's a wee bit unknown at this stage. So some of the questions that I've been asked is, if you're unwell, should you have the vaccine? And in fact, if you're unwell with diabetes or heart disease, you're exactly the person that the vaccine has been designed for. How did they develop it so quickly? Well, we talked about that. There's a good 20-year history there going back of the development of this. So I don't think it's something that's suddenly been pulled out of a hat. Is it safe? Well, any medicine has side effects, and there's always a balance between, do you want the vaccine or do you want COVID? In my view, the vaccine is far safer than having COVID itself. And really, you're not just doing it for yourself either, you're doing it for the people that you may pass it on to. So although you may get COVID and get through it fine, you may pass it on to an older relative who may get a significant illness or even die, or you may pass it on to someone else who may get one of these long COVIDs, which are the COVID which is difficult to recover from. So weigh the risks and the benefits for yourself. And if you've got any questions, give us a call at Horatāpai or come and talk to one of the nurses or one of the doctors. We're happy to talk you through these questions. Everyone has to make up their own mind. We're not really interested in telling everyone what they have to do or twisting anyone's arms to do it. But if there's information that's going to make it easier for you to make a decision, please get in touch with us. And just to finish off, this is where I've got the information for this presentation. The Immunisation Handbook, which is put out by the Ministry of Health in New Zealand, very good source of information. Some information from the Information Advisory Group, and then the World Health Organization does weekly updates, epidemiological updates of the pattern of disease, and I've quoted from the edition 48 from the 13th of July. I hope you found this useful, and like I say, don't hesitate to be in touch with us at Hortipi if you want to discuss things further before you have your vaccination.